Today, we'll talk about terms of movement in anatomy, because anatomy is not just a science. It's a language you have to understand the terms. Flexing versus extension, abduction versus adduction, or abduction versus adduction. Supination versus pronation. We shall also talk about internal rotation versus external rotation. There will be some clinical implications. Now let's get started. Have you ever wondered what the word anatomy even means? Ana means uptomy, means to cut. There is a machine used by the pathologist, known as the microtome. Micro means small or microscopic. Tome means to cut. A microtome is a thin slicer. It cuts into tissue. Tome is to cut, and it means up. Anatomy literally means to cut you up, to dissect you. The first terms of movement. Flexion versus extension. What is flexion? Bending. What is extension? Straightening. Whenever you're talking about a movement, you have to refer to the joint that's being moved. Which flexion are you talking about? Oh, I'm talking about elbow flexion, or I'm talking about shoulder flexion, or I am talking about hip flexion. You have to specify the joint. In this case, we are flexing the elbow or extending the elbow. But can you give me the technical definition of flexion? Sure. Flexion is the movement that includes the following. 1. Approximation of two morphologically ventral surfaces. Ventral, of course, means interior. You're getting this part closer to this part. By flexing the elbow. 2. You're decreasing the angle between these two parts of the body. And 3. Flexion is what helps you assume the fetal attitude or the fetal position. Example. This is flexion right here, but when you arch your back, that's called extension of your vertebral column. Okay, medical system. In both the definition of extension, it's the reverse reflection, and it's the movement that includes the following. Moving to ventral surfaces away from each other, increasing the angle between the two parts of the body, and assuming a position that's opposite to that of the fetus. When you talk about the flexion of the thumb, flexion of the thumb is the thumb moving inwards. And when you're standing in the anatomical position, the thumb is moving immediately, i.e. towards the midline of your body and closer to your fifth digit. Next, it's time to talk about abduction versus abduction. Abduction is the movement which carries your extremity away from the median plane or away from the core of your body. How about abduction or adduction? It's the exact opposite. It's the movement which carries your extremity closer to the median plane, towards the core of your body. Do we have exceptions or special circumstances here? Sure, when it comes to your digits, fingers and toes. Adduction and abduction are slightly different. In this situation, abduction means that your digits are moving away from each other. They are fanning out. It's the movement of your digits away from the long axis that starts here and goes backwards. This axis is the exact same as the long axis of the second toe or of your middle finger, which is slightly inappropriate for a scientific discussion about adduction. Then it's the exact opposite. It's the movement of your fingers or your toes closer to the long axis that we have just mentioned. What's next? Rotation. We have internal rotation and external rotation. Internal rotation has another name, median rotation. External is also known as lateral rotation. Look at this arm. This is external rotation. Naturally, it's rotating away from the median plane, away from the core of my body. How about median rotation? Or internal rotation is the exact opposite, is the rotation of the extremity or the limb towards the midline. But wait, there is more. Supination versus pronation. Oh, by the way, this movement is unique to the forearm. You do not find this just anywhere in the body. No, this is peculiar. The forearm, they are rotation movements. Supination is like this, but when you flip it, it's pronation when your palm is looking to the sky. This is supination when it's facing the ground. It is pronation, but what's the technical definition? Just remember that you have two bones here, radius and ulna. Radius is the lateral bone, but the ulna is the medial bone. Now here's the definition of supination. It's when the radius lies parallel with the ulna, and the palm is facing forward conversely. Pronation is when the radius crosses in front of the ulna over the ulna, anterior to the ulna, and when the dorsum or the back of your hand faces forwards.